Hi, and welcome to an introduction video on the 2A arm system. I'm making this video to help you understand how it works so you can best apply it to your patients. First, what you'll get are two spreader bars with two bolsters. The thicker one obviously is for the lumbar spine and the smaller one for the cervical spine. You do get one higher rated pulley which can be used for the lumbar spine. And for the cervical, you can just use one of the standard size pulleys that comes with your table. At the moment, it doesn't come with your kit. Coming out shortly is going to be a 5x pulley system for the lumbar, and then that'll leave you with this one. You can use this for the cervical spine. There are two main arms with the pulley system. The bigger arm is rated at 500 pounds, and the smaller arm is rated at about 200 pounds. Traditionally, we'll use the bigger arm for all your main pulling, and the secondary arm is going to be used for any of your lower force secondary pulling, like when you do 2A cervical traction. This will be used for distraction, and this will be used for your main anterior pull through the cervical spine. There are two levers here. One is for the inside lever, which will move the primary arm, but it also moves the secondary arm at the same time. So if I release this and then move it, you'll see both are going to move, whereas the secondary arm moves independently. So generally when you're using the system, you always set your primary arm first and then move the secondary arm later. When using the arm system, the general principle is that you want to leave yourself enough length here in the direction that you're pulling in so you don't run out of travel room. So say we were pulling upwards in the lumbar spine, we want to make sure that this is high enough so that we don't run out of room as we're pulling through. There's a lever down the bottom here which can help you vary the height. So you release this and lower it down. So if this is positioned too low and I'm trying to do lumbar traction, I'm going to run out of room here. So what I want to make sure is that this is high enough. This comes up quite high. Generally you won't need it even that high, but there's enough room now to make sure that you don't run out. One thing you'll note, that this main arm is rated at 500 pounds if you're pulling straight up, or if you're pulling back towards here. So if you're on this angle here, if you're pulling on this angle here back towards the middle, that 500 pounds still rates. But if you're going to angle it there and pull straight up here, it's going to change the rating of the equipment. So if you have it set at a 45-degree angle and you pull up at around 200 pounds, the center pin here will start to bend. So what you want to do is make sure that you have this fairly upright so you don't wreck the equipment. So you can pull straight upwards here or here to about there. That's fine. So if a patient lays down on the table and this is not quite in the direction that you want to pull, you have three options. You can ask the patient to move, or you can move this a little bit, or you can release the frame and move it down the table. But try not to do it too far here and pull straight up, because then you're going to damage the equipment. One thing I mentioned just before is that you can unhinge this, unclip this from the side rail and move it up and down the table. There's a quick release lever here. You can just unhinge it. And then there are wheels on the outside of the table, on the outside of the arm, so you can lean it back. You can roll it down the table and then move it back and then clip it back onto your new position. When doing 2A cervical traction, you'll position the patient on the bench and you can decide with the primary arm what direction you want to pull through the cervical spine, whether it's lower, mid or upper cervical spine. And from there we can set the secondary arm to the direction of where you want to pull. And the idea is that you've got enough distance here and enough distance here, so you don't run out of either way. So when the patient's on the bed, you want to have this as low as possible generally. Okay, so here it's set at 1. I can sometimes put it down to 0. And there'll still be that much room to pull anterior. Okay? If you're running out of room here, then this has to go higher. The advantage of having this as low as possible is that it gives you as much distance here as possible. So if this is too high, then you're going to run out of room here if you're trying to pull down. So what you'll see here is I have the patient now more anteriorly. Say I'm creating anterior thoracic trunk translation. I've put blocks here and I've raised her up. That has now decreased the amount of travel space I have here. So what I would need to do is raise this up. Now I have that travel space, and then I can still use the arm here. So here's an interesting one. In this traditional full spine setup where I'm creating lumbar extension, thoracic flexion, and cervical extension, I'm actually using the two-way at the same time for when the patient can't handle any compressive forces like in the upper cervical area. So I'm doing some distractive forces in the neck and still using the two-way through here. So I've still got the cervical piece in here to use to help to create thoracic flexion, but instead of just using a strap or a head weight or anything for cervical extension, I'm actually using the two-way at the same time. Now when I do this, her position here is higher up off the table. So I've had to make this higher, so this one is at position 3 now, as opposed to being too far down at position 0 or 1. If that was the case, I'd run out of room here. If I have it too high, I would run out of room here. Hopefully you find this video really helpful, and if you have any questions or queries, please feel free to leave them in the comment section underneath.